Thank you for watching KTN. Welcome back to the Uasin Gishu County Focus. As we today focus on matters to do with health in this county. I have 4 gentlemen who are in charge of healthcare in this county. Before we went on break, we were talking about preventing healthcare, preventive pretty much increase of diseases in this county, what they are doing, improvement of facilities here. And yes, indeed. Now, I just want to talk to you, Dr. Evans. Now, Evans, as we talk about matters to do with healthcare in the county, there is the matter to do with the renal unit in Ziwa. And we know matters to do with these services is actually not only an important aspect here, but across the country. So in terms of developing these all the way to Ziwa, what was the thinking about it? And in terms of having this facility there, how has that reduced the pressures in hospitals like MTRH and other big facilities in the town?
Thank you, Dennis. Let me repeat what I said at the beginning. Mm-hmm. We want to improve access to healthcare. Mm-hmm. And access means you take the service near where the public are. Now, one time, obviously, we went with the CEC and the team to MTRH. Mm-hmm. The number of patients being dialyzed on a daily basis goes higher than 100 patients daily. So the machines must run almost, you must get up to 4 or 5 patients per day. So with this in mind, obviously, if you look at where they come from all over, within the county and even outside the county. So now, for us, we decided to also create a center 70 kilometers away from town to make sure that we also capture that far end of the county. So we created 4 beds for dialysis in Siwa. It's in a rural setup where probably most people could wonder, where will you get the patients from? But the patients in almost all hospitals come from some household somewhere, where either urban or rural. That actually informed us of the fact that we need to create some additional centers elsewhere. Just like what the chief officer was talking about dental, we used to have one here, but now we push to almost every sub-county is now having such a service, purely increasing access to healthcare. So far, we had the patients who are there, we've registered, and going through dialysis almost on a weekly basis is more than 20 patients there within Siwa. So they come in the morning, around there, they're dialyzed, and they go home. We have staff, I think we have 6 nurses trained on renal, on renal dialysis basically. And they've been doing a good service. In fact, the numbers are coming up, they actually are adding up every other day. In fact, the other time we used to say 4. Now we are talking about 20. And we believe the numbers are still going up. So to us, we're reducing the pressure in MTRH. It also eases the cost of healthcare to this particular patient who is seen near home. They can walk in the morning and walk back in the evening without any major issue. So basically, that's what we are doing there.
And Bona CEC, now there is the issue of gender-based violence that continues to be registered across the country. Now, Uasin Gishu County has set up a gender-based violence hospital and center that is dealing with these matters. I mean, what informed that, and how has this changed the matters, the cases that have been reported in this county? Because I know one of the greatest services offered there could be just talking to patients, counseling, and also just telling people how to deal with such matters. Take us through that.
In Uasin Gishu County, we have gender-based violence centers. We have at MTRH, and we also have several centers based at our sub-county hospitals. We have one at the Uasin Gishu District Hospital. We have another in Ban Forest, Ziwa, and Tarbo. Now, ideally in these centers, we know the realities of life currently is such that people or several families experience gender-based violence at some point in time, maybe due to several factors, including economic issues. We know these are cross-cutting issues that affect our society today. Now, these centers ideally is to save the various gender, the various people women, and even men, unfortunately, from these violences. We have a counselor at this center. We have those specialists who will observe, who will engage, and they are taken through the various medical tests. And more importantly, we have a legal person who will, of course, inform the patients of their rights and where action needs to be taken. Then the hospital will take up the matter. And of course, the administration now follows it up.
Now, Dr. Paul, as we could talk about matters to do with gender-based violence and the counseling aspect of it, we also note that services like rehab facilities have been set up in this county. Talk about the new center in Moiben being put up in place. What is the success on that?
Thank you very much. What I would say is, as a society, we are continuously experiencing increased mental health concerns and mental health issues. So we, as a county government, have decided to cautiously and deliberately delve into the matter of mental health. In Moiben Sub-County Hospital, which is at the periphery, we saw that many people seek services at the city center, at MTRH and at other facilities. So we saw it proper to have one at the periphery. This health facility, of course, it is manned by our Alcoholic Drinks and Control Board. We have an Alcoholic Drinks and Control Board in the county, which is involved in the licensing, the regulation, alcohol regulations. And we even have so many other counties have come to benchmark and see how this board is operationalized. So this board is the one that is in charge, under the Department of Health, it is in charge of the rehabilitation center. This center is open to the public. It is open to even members of staff who would wish to seek assistance in the rehabilitation center. We have other rehabilitation centers in the county which are actually overcrowded. So we have one which is well equipped, and we have partnered with University of Moi University. We have partnered with a program called I Am program, which is a USAID funded program. All these people come together and ensure that the mental health status of the citizens of Eldoret City and Uasin Gishu County is well taken care of. Thank you.
And yes, indeed, this is just some of the successes that we continue to record here in Uasin Gishu County, Eldoret Town, matters to do with healthcare. But let us just take a walk through this facility right here. That is Mama Rachel Ruto Maternity Hospital, and look at this facility, the newborn unit. We shall be talking to Nurse Charles a little bit later as he continues to also bring us up to speed on the successes that do exist here. But I want to talk to you, Bwana CEC, briefly just take us in a minute on the successes that have been realized in the healthcare sector in this county. A minute.
Thank you. Very quickly, Uasin Gishu County has had its success stories in healthcare, and especially from the time the governor, Jonathan B., formed his government, there has been several success stories. One is where we are currently. This is a 70-bed facility with state-of-the-art equipment, from the neonatal unit to the theater, and this place is serving all mothers from across several counties around Uasin Gishu. Number two is we have the renal unit, of course, in Ziwa. Number three, we have a state-of-art facility coming up in Keses, which is at 85%. It's a level 4 facility, and we hope in this financial year we should be able to complete. We have dental units in various sub-county hospitals. One is Kapteldon, another one Huruma. We have it in Banbrook Forest. We have it in Ziwa. We have the eye unit in Huruma Hostel, we have it in Capteldon, we have it in several other places. We have X-ray units distributed across the county. In essence, what we seek to deliver is service closer to our people, service closer to the Mwananchi. This is reaping on the devolution dream. More importantly, we are reaching out to the young. You've been made aware of the milk program, for example, which is nutrition to the ECD learners. We have the dental program, the oral program, which is reaching out still to the parent and to the young. These are some of the success stories as outlined in the Nguzo Kumi.
That is pillar number 2. And yes, indeed, when we talk about successes, let us take this walk towards the newborn unit and just look at these successes that we are talking about. Just kindly follow me as we just talk about matters to do with healthcare. Now, as we talk about matters to do with healthcare, this is a new facility that has been put in place in just making sure that everything works well. You can look at the beautiful pictures talking about children enjoying their noodles. That is important because that is about nutrition, and also children just being children, being allowed to play. They say when Paul is a busy person and does not play, they become a lonely person. That right there. Also just painting a clear picture of how accommodative this place is. Also right there, another beautiful picture of a child and their toys. But now we are at the newborn unit where only authorized individuals have been allowed. But today we'll talk to Nurse Charles, who will just be talking about matters to do with what happens here. Take us through everything that happens here. Bonne Charles.
Welcome. I'm Nurse Charles. This is our newborn unit. And kindly, you can sanitize. Put on your masks and your headgear.
Where do we start from? We sanitize first, or we wear the...
They're all sterile, so you can sanitize first.
All right.
Yeah, or sanitize last. Then you can remove your shoes and put on what we've availed for you.
Oh, okay.
Under normal circumstances, we wouldn't allow you being the way you are dressed.
Oh, okay.
But maybe for today, we'll make an exception.
Supposed to wear the kofia?
Yes, please. Karibu. This is where we receive our babies.
Okay.
Before admission. So maybe if they've been born here, we'll receive them here, then get them into the NBU here. We just remove all the clothing to avoid contamination.
Okay.
Then we just take them in.
So this is the first point where a parent would meet their baby. Can you just take us through?
Okay. Now, these are just baby warmers or resuscitators, where most of the times we keep babies who are just for observation. And they're not critically ill.
Okay.
Then we also have what we call a tunnel phototherapy. This is simply used for neonates who are suffering from jaundice.
Okay.
Jaundice is just a discoloration of the skin and the eyes. There's a yellow pigment, which is a byproduct of red blood cells being broken down. Then at times they get excess in the body, then the babies will suffer from jaundice.
Okay.
So we use this state-of-the-art tunnel phototherapy, whereby most of the times we put the babies for a maximum of 9 hours, then maybe repeat the bilirubin levels. Then from there we can now make a judgment of whether to continue with the phototherapy or to stop. Then we have our traditional phototherapy machine. This takes more time with the babies. Most of the times, the baby here can stay for maybe 24 hours to 72 hours. Then from there, we can also repeat the bilirubin levels. from which we can make an assessment of whether to continue or to stop. We also have incubators. For now, we don't have a baby in the incubator. The incubators are mostly for the preterms. Those are baby who are born before completing 37 weeks of pregnancy. So most of the times we receive them in the NBU and put them under the incubators so that we can monitor everything about them. We can give them medication there. We can also fix oxygen there. We can put the feeding tubes and take care of them till they are due for discharge.
And Nurse Charles, now as we go through these facility right here, we see that it is actually personally it is great that we have these. How has this improved service delivery to the people, especially mothers in this county, and also in terms of numbers, how many are seeking the facility services here?
So far, since we started the newborn unit, that is sometimes in July, we've seen around, or we've admitted around 21 neonates. Those are babies who are between 0 to 21 days of life. And so far, we can see the benefits to the community in that they cannot now travel very far for services. We have all the services here, and as you can see, it's a state of the art. And we also have qualified personnel from specialists all the way down to subordinates. So anytime there is any issue, we are up for the challenge.
And also in terms of, as we just make our way towards where the camera person is now, as this facility is here, how would you say in terms of this being a game changer in maternal and newborn services being sought in this county?
This is a first of its kind in the entire Uasin Gishu under the county government. We have the Moi Teaching and Referral Hospital being almost like a private entity as much as it's public. It's a parastatal. But under the management of the county government, we have this as a first. So it is a game changer in that initially we used to refer all our clients to MTRH and they used to have an overload. So maybe even if it was a baby who is unwell or who wanted phototherapy, you'd find they would wait before they get the services. But now here, we're always on standby. We have 4 phototherapy machines, always on standby for the babies.
And also, finally, as we get ready to just sign out and let the people at home know what is happening here. Now, this is a service that mothers have yearned for a very long time in this service in terms of accessibility. We've seen this is a little bit away from the city center. What would you say? When mothers live here, are they smiling? Are they happy? Fathers, when they see their newborn at the first entry level, what do they say? I want you especially to talk about the men in these women's facilities in a minute.
Okay. With the men, this is a very accommodating facility whereby we encourage the male involvement in childcare and also during birth. So most of the times you find both of the parents, they came together to accompany the mother for childbirth. Then if by bad luck, maybe the baby is to come here, then we receive them both and we take them through everything that needs to be done to the baby. Then we admit the baby. Then we also give daily updates to the parents on how the baby is doing. And most of the times, all through discharge, we are together with the parents.
That is Nurse Charles taking us through the newborn unit right here, saying that this is the first of its kind. When mothers come here, they live happy. Men are being encouraged to actually just be part of this exercise. The gentleman behind me, that is the CEC, Director of Medical Services, including Dr. Evans, who's in charge of preventive and promotive healthcare, just telling us that this is a game changer for this great county. My name is Dennis Aseto. We continue with the County Focus edition of Uasin Gishu County, Eldoret, from a town to a city. Good evening.